So, right now, class, alam ko wala akong feed ng ano ko ngayon, ng camera ko. I'm currently recording this rationalization of our quiz from last time para mabalik-balikan ninyo. So that we can understand, class, how we were able to derive the answers to our quiz. Okay, so first question, obviously walang mali, very good. Everybody got this correct. So in pharmacokinetics, we assume that higher concentrations of the drug in the bloodstream, the stronger the pharmacologic effect will be. Of course, this is in connection, class, sa ating kinetic homogeneity principle. Okay, which is, sabi nga doon, a pharmacologic effect of a drug is directly related to its dose or to the concentration of drug reaching the plasma, the blood. Okay, so dito may nagkamali. Ilan? Tatlo. Okay, so which of the following is not a pharmacokinetic parameter? Okay, so very good. At least majority of you know that it's lipophilicity. AUC, class, or also known as area under the curve. Okay, it's one of the basic pharmacokinetic parameters na ginagamit natin to assess for bioavailability. Okay, because it measures the total amount of drug absorbed in the system with respect to time. Okay, lipophilicity on the other hand, class. Okay, this is a physicochemical factor. Okay, it's a physicochemical property of drugs. Okay, as you all know, class, lipophilicity, the more lipophilic a substance is, mas mabilis siya nakaka-penetrate sa ating mga cell membranes. And it's an important parameter, class. It's an important property, but it's not a pharmacokinetic parameter. Okay? Next one. So, majority of you got this correct. Okay, very good. Huwag natin discuss siguro yung masyadong maraming correct. Dito tayo. Branch of pharmacology that deals with the disposition and fate of drugs. Now, remember, class, when we're talking about disposition, hindi ba sabi natin, class, tatlong processes ito? You have distribution, metabolism, and then we have excretion. Alright? And that is part of, ang nawala lang naman dito is absorption. And yung apat na to, class, comprises our kinetics. Okay? So it's very, pharmacodynamics, not really. Kasi pharmacodynamics, class, is more of drug effects. Okay? Drug response. Yun yung sa pharmacodynamics. Right? Pero not really more on pharmacokinetics. Okay? Or not more on, disposition of the drugs. So pag disposition ang pinag-uusapan natin, that's more of pharmacokinetics. Okay, ito may mga ilan nagkamali. Branch of pharmacology express the relationship between plasma drug concentration and time. Kasi, class, excuse me, kung ito ay plasma concentration and drug response, well, actually, critical kinetics pa rin yun. Okay, pero kasi, class, here, it's very clear that we're talking about time. Concentration and time. Kasi, class, when we're dealing with concentration with respect to time, that's very much kinetics. Okay, ang dynamics kasi, class, is more of drug response. Okay? Yun yung keyword dito na hinahanap natin. Pero when it deals with plasma drug concentration with respect to time, that's more on pharmacokinetics. Okay. Next one. This branch of pharmacology deals with receptor occupancy leading to biological response. So, very good. Ang keyword again natin here is response, and that is more on dynamics. Okay? Class, ulit-ulitin ko to ha. Kadalasan, class, we don't really talk about the type of response created sa pharmacokinetics. We just know that higher the concentration, the greater the response. Yun lang ang relationship na pinagtitingnan natin dito. Pag pharmacodynamics kasi yung class, we qualify the response. Okay, kung ano nangyayari, paano nangyayari yun. Okay, yung MOA ng gamot natin, dito pinag-uusapin sa pharmacodynamics. Okay? Pero sa kinetics, we don't really talk about those things. We just talk about, as time goes on, ito yung resulting concentration. Okay? Oh, this one. Which of the following route of administration has a Cmax at time of administration? When you say, class, time of administration, Ito yung time, concentration at, time of administration. Okay, concentration time of administration is also your concentration at zero time. Okay? At zero time. So, ibig sabihin, if this is my plasma level time curve, at zero time, nasa Cmax agad daw. So, anong route of administration ito? And obviously, class, that's intravenous route, IV route. Now, if you think about it, class, ano ba yung mga IV routes? We have your intravascular, intra-arterial, and then, of course, intra-cardiac. These are the three routes of administration that belongs to intravascular routes. Okay? IM class is part of the extravascular route, the same with subcutaneous and intrathecal. Intrathecal class is the administration of medications via the spine. Okay, sa spine. And we all know, class, that intrathecal route, okay, is actually part of the peripheral compartment, meaning it's a poorly vascularized compartment. It's a poorly vascularized tissue. Okay? Excuse me. Therefore, class, the more appropriate answer here would be, of course, intracardiac. Okay, being part of the IV route. Ito pa, marami nagkamali. I'm surprised actually, pero na-discuss na natin to eh. Okay, therapeutic window describes with absolute certainty the concentration range at which a drug is both safe and effective. Now, this is very much false, class. Why? If you remember, okay, ang discussion natin here is, what if allergic ang isang patient sa gamot? Even if the drug is within the therapeutic window, patient will still suffer adverse drug reactions. Okay, or for any idiosyncratic reaction. Okay, which makes it not safe for that patient. Kaya class, the therapeutic window will not tell you with absolute certainty what is safe and effective. Okay, this is safe and effective for the majority of the people, okay, for the majority of the population, but it may differ from an individual's perspective. Alright? Ito yung dyan eh, yung takeaway word dyan eh, absolute certainty. Talagang siguradong walang mangyayaring, ayan ang concentration that is safe and effective. Again, class, that's not true all the time. Okay? Especially for drugs or for people with allergies towards a certain drug. Okay? So ito, kinetic homogeneity states that, again, class, ang relationship dito na titingnan natin is concentration to drug effect. Okay, or pharmacologic effect. It's very good majority of you got this correct. It's not dose to plasma concentration. Okay? It's more of plasma concentration of the drug to its pharmacologic effect. Now, assumption natin is, higher the concentration, higher the effect. Okay, rate and extent of drug absorption is, very good, that's called bioavailability. This is the very definition of bioavailability. Which route of administration has an absorption rate constant? Okay, again, IV versus EV, extravascular. IV class, di ba sabi natin, at zero time, it's already at its maximum concentration. Hence, it bypasses absorption. Hence, it doesn't have an absorption rate constant. Unlike that of extravascular, okay, it has an absorption phase. Okay? Yeah. So at least majority of you got this correct. Alright? So yun, tandaan nyo class, intravascular, wala na siyang absorption phase. Walang absorption phase na nangyayari dito. Kasi nga, 100% na yung bioavailability niya. 100% absorbed. Okay. Next, which of the following pharmacokinetic parameter measures the extent at which drug leaves the intravascular fluids going to extravascular spaces or its target sites? So very good. The correct answer here would be volume of distribution. Okay? Kasi VD class is a measure of a drug's ability to distribute. How well it distributes. It transfers from one fluid compartment to the next fluid compartment. The higher the VD class, ang assumption natin is, mas mataas din ang distributive capacity ng gamot. So that's why we say increase in VD means increase in distribution. All right, this is the point in which plasma level time curve, in the plasma level time curve where the amount of drug absorbed is equal to the amount of drug eliminated. So very good, most of you got this correct. It's Cmax. It's not therapeutic window, class. Therapeutic window tells you what is the concentration at which drug is considered to be safe and effective. But not in absolute certainty. Okay, Cmax on the other hand, class, or pwede rin dito CSS. Okay, is where absorption rate is equal to elimination rate. Okay, the amount of drug absorbed is equal to the amount of drug eliminated. That's in Cmax or at steady state concentrations. So next one, it measures the rate at which a drug disappears from the body. So very good. That's KE. It's elimination rate constant. Okay? Kung may sagot ng KA, this is absorption. VD is volume distribution. And F refers to bioavailability. I hope you understand, class, ito, I guess in a sense, memorize kung ano yung mga mnemonics na ginagamit natin here sa kinetics. Para natin maintindihan natin yan kasi ang hirap class isulat lahat, like bioavailability. Okay, F na lang usually yung ginalagay natin. Pwede rin BA, pero F is the more preferred term or mnemonic. Alright, very good. Everybody got this? Same goes with this. Right, may ilan nagkamali dito. TDM is useful for which of the following scenarios? So TDM class is very useful for if a drug has a good correlation, drug concentration has a good correlation with its pharmacologic effects. Very good. Okay, of course, hindi yan ginagamit for drugs with large therapeutic index like paracetamol. Okay, TDM is very much useful for drugs whose effects cannot be easily assessed. Normally, titingnan lang yan through its drug concentration. Now, class, this one. Drug has minimal inter-subject variation in plasma drug concentration following a given dose. If masyado nagbabari kasi yung effect ng gamot sa tao from one person to another, hindi na advisable class mag-TDM. Okay? Or sorry, kung hindi siya masyado nagbabago-bago. Okay? If a drug has minimal inter-subject variation, hindi na natin kailangan i-TDM to. Okay? Kasi kung pare-pareho naman sa general population yan, carry boom boom na. Unlike, say, for example, as vancomycin, it greatly varies if a patient, the pharmacokinetics of vancomycin varies if a patient has kidney problems, say, for example, or masyadong malaki ang katawan niya, masyado siya maraming fats, okay, or the patient is obese. Iba kasi ang behavior ni vancomycin for patients like those. Unlike paracetamol, generally, it's similar to everybody. The pharmacokinetics of paracetamol. TDM is useful for drugs with no well-defined therapeutic plasma concentration range. That's definitely false. Kasi class, ang pinaka-basis ng TDM natin, therapeutic drug monitoring, is the therapeutic window. Okay? Nakabase tayo sa decisions natin in TDM based on the therapeutic window of the drug. Kung pasok pa ba siya sa MEC or lumagpas na ng MTC. So the use of TDM is limited for drugs with pharmacologic active metabolites. Very good. That's true. Kasi if a drug has a active metabolite, okay, mahirap i-TDM yun. Kasi yung metabolites yan, nagkikreate pa ng effects. Ang assumption natin dito is usually, basta na-metabolize na ang gamot, wala na, tapos na yung effect niya. Okay, hindi naman kayang i-measure ni clinical pharmacokinetics yung effect nung active metabolite. Alright. This one. TDM is useful for drugs whose toxicity occurs at low doses or at therapeutic concentration. Okay, of course, that's false. Kasi class, hindi na useful si TDM kapag low doses pa lang, may toxic effects na siya. Okay? Kasi immediately may nakikita ng effects . TDM is usually useful class for drugs whose effects or whose toxic effects occurs after a later period of time or kung once nag-accumulate na yung drug sa katawan. Kasi class, kung nakikita ko immediately may toxic effects ng patient, alangan naman i-continue ko pa ang gamot, right? Titigilan ko na yon. If I'm seeing my patient suffering from seizures from the drug itself at minute concentrations, I'll immediately stop that. Okay? It doesn't make sense na i-continue mo pa yung medication. Okay? Here, maraming nagkamali. The amount of drug in the bloodstream is always the same amount of drug binding to its receptor. Again, takeaway here is the term always. Di ba sabi natin, class, this is not true all the time. Okay, it's only true for some drugs, but not all drugs. A good example, class, is digoxin. Okay, I keep making this as an example before. Digoxin, class, whose target is the cardiac myocytes. So, ang tendency, class, is the amount of digoxin in the blood is very minimal because most of that digoxin is going to your heart muscles. That's why, class, when you get plasma concentration, or when you assess the plasma concentration of digoxin in the blood, it's very minimal. Nanograms ang measurement natin dito. Hindi micrograms, hindi milligrams. Okay? Kasi sa ganong very minute amounts na lang ang natitira sa bloodstream. Kasi again, it goes directly to the heart tissues. Okay? Kaya the amount of digoxin in the bloodstream does not reflect the amount of the amount of digoxin in the heart muscles, which is the target sites. So it's not always the same. Okay. Chemotherapeutic drugs like cisplatin requires therapeutic drug monitoring. Now, this is actually, I think I've explained this before. Okay, before we started with our lecture, or with our quiz from last time. Okay, so sabi natin class, no. Kasi therapeutic drugs like cisplatin creates, minsan-minsan na ito ginagamit. Okay, per cycle lang yan. You don't need to monitor its plasma concentration because obviously, class, we usually give this at a high dose. And the side effects class of chemotherapeutic drugs like cisplatin is almost immediate. Okay, nakikita agad yung side effects niya. Okay, and then lastly, all high alert medications like insulin requires therapeutic drug monitoring. So this is very much false. Do you think, class, pag nag-insulin tayo, okay, kailangan i-measure mo yung blood concentration niya every time? Okay, kailangan ba natin i-measure yung insulin concentrations? Hindi naman, di ba? Kasi, class, again, some high alert medications create side effects immediately. Okay, so therefore, class, makikita mo agad kung whether or not you need to stop the medication or not. Unlike with other drugs, class, that requires TDM, okay, drugs that requires TDM, class, takes time before they elicit their adverse drug reaction. Okay? Kaya natin minomonitor yung kanyang plasma concentration. Alright? Okay, so that's pretty much it, class, for our first quiz.